Hi, I'm Jack Farr. I'm going to discuss IntraOsseous BioPlasty of the medial femoral condyle. This is just a case example. So the history, it's a 45-year-old male. This is very typical of a degenerative meniscus tear, mild swelling, incomplete range of motion, positive McMurray. So in most of these cases, you're thinking, well, he'll do well with a partial meniscectomy. If you look at his preoperative imaging, however, you're going to see this intense bone marrow lesion of the medial femoral condyle. And certainly from my standpoint, this is very scary to me, especially before I had options of treating these bone marrow lesions. This patient would have a high probability of having persistence of pain, or with a partial meniscectomy, actually having increased pain, especially if they're malaligned. So in this case, we do have the option of treating both the mechanical symptoms of the meniscus and the pain generator within the bone. So what would you do? Before we had subchondroplasty or bioplasty, you'd probably just do a partial meniscectomy, put him in an unloader brace, and hope for the best. So in this case, concomitant with the arthroscopic partial meniscectomy, and you can see on these slides, the articular surface looks good. The meniscus was a straightforward flap tear, and then you can see on the left, the injection. Postoperatively, basically, we're treating these like a stress fracture, so we're trying to keep them off of the limb while they are concentrating on a core-to-floor approach to strengthening, and trying to get them to at least wait 3 to 6 months before they're going back to high-level activities. Obviously, it's patient-specific. How much do they weigh? What's their malalignment? And what is their desired activity level? You can see 6-week follow-up. He already has had marked improvement of the bone marrow lesion and was asymptomatic. Certainly, long-term follow-up is going to be necessary, and that's really going to tell the story. Currently, we've done approximately 70 of these, and we have an ongoing registry, so we'll be following these and hopefully can report in the future.